Hello, my name is Miss Maria Keiko Yasuoka. I'm a mixture Russian Japanese, so I have almost white skin and blonde hair. I'm a woman and I'm speaking at home in Japan now. I am a visiting researcher at the Oda University of Commerce, Oda City in Hokkaido, Japan, another part of Japan. So today's title is Japan plans to downgrade COVID-19 in May 2023. What does this transition mean for organ transplant patients? Next slide. First of all, introduction. COVID-19 in Japan 2020 to 2023. From 2020 to 2023, more than 10,000 people were infected with the COVID-19 in Japan during the first wave from April to May 2020. 1.5 million people during the fifth wave suffered COVID-19 from July to October 2021, and 31 million people suffered COVID-19 during the eighth wave from November 2022 to January 2023, and more than 33 million people suffered COVID-19 as of May 8, 2023, when downgraded day. And it is said that the peak of the ninth wave would begin by the end of the summer vacation from July to September 2023, 2 months after the downgrade of the COVID-19. Next slide. Background. Number of infected people in Tokyo. As the COVID-19 status downgraded to Category 5 on May 8, 2023, the data showing the infection state of the COVID-19 changed from the previous complete grasp. The system has now changed to fixed point monitoring, which is made public based on report from 5,000 medical institutions nationwide. On May 19th, people was 17.1 persons per one medical institution during the week from August 28th to September 3rd in Tokyo. Next slide. Japan downgraded COVID-19 in May 2023. The Japanese government downgraded the rating for the COVID-19 infection from Category 2 to Category 5 on May 8, 2023. Category 2 is the same level as tuberculosis, and Category 5 is on the same level as influenza. The pandemic came to an end, but as regulation eased, the COVID-19 is treated like influenza, and Japan takes the first step in the post-corona era. However, the eighth wave is more serious than the eighth wave, and the summer of infected people is higher than before the downgrade. Next slide. Organ transplant in pandemic. In Japan, organ transplant law was finally established in 1997, and to date, the number of organ donation has totaled only 986 cases in the past 26 years. Also, Japan is said to have the most severe organ shortage among medically advanced countries. The number of transplant candidates is increasing. Naturally, organ transplant surgery, where infectious diseases are the enemy, was cancelled at the beginning of the pandemic. Next slide. Organ shortage in pandemic. The organ shortage during a pandemic was even more acute than in normal times. Due to organ shortages in Japan, most recipients rely on living donors or overseas transplant. Living donor transplant carry high risks for both living donor and recipient, and overseas transplant was forced to decrease or cancel the transplant due to international travel restrictions during the pandemic. Next slide. Vaccines and medicines. As it was the first pandemic for transplant medicine in Japan, infectious diseases are the barrier because the recipient must take immunosuppressant. Also, vaccines take a longer time for recipient to become effective, and its effectiveness is shorter, so 3 vaccinations are recommended. In addition, transplant surgeries were cancelled because the ICU intensive care unit was full with the COVID-19 patient. This pandemic has exposed various problems, and there are expectations for comprehensive development of organ transplant medicine. Next slide. High-risk medicine in the pandemic. Medical care for high-risk people in Japan during this pandemic has exposed many problems. Higher risk medical care has begun to dominate high-risk one. As a result, hospitals were overflowing with COVID-19 patients, and there are no space for transplants. Furthermore, if no high-risk patient developed a fever, there were no hospitals that accepted them, and they were required to find attend fever outpatient clinics, resulting in outpatients disappearing from hospitals. Next slide. Japan on May 8, 2023 in pandemic. On May 8, 2023, the COVID-19 was downgraded from Category 2 to Category 5 in Japan, and we are returning to normal daily life. However, the situation in Japan on that day was between the 8th and 9th waves of the COVID-19, with more than 33 million people infected and more than 74,000 people deaths. In particular, the number of deaths who were waiting to be hospitalized at home reached a record high of 1,309 people died. And opinions were divided between the government and the medical experts regarding the downgrade timing. Next slide. Category 2 to Category 5. In Japan, the COVID-19 was downgraded from Category 2 to Category 5 in May of this year. Specifically, Category 2 corresponds to tuberculosis, bird flu, etc., and Category 5 corresponds to influenza and measles, etc., is equivalent. However, the mortality rate of the COVID-19 is more than 5 times higher than that of influenza. This downgrade measures was the first step towards Japan's post-COVID-19 era. Next slide. Change points. The main changes after the downgrade to COVID-19 Category 5 are: 1. The government doesn't need to control the infection of the people. 2. The people don't need to refrain from going out even if they are infected. 3. We can use a wider range of medical institutions due to the abolition of COVID-19 hospitals. 4. The public medical expenses that were free for Category 2 have been abolished, but a new subsidy for some public medical expenses has been established. This is Japan's first step in the post-corona era. Next slide. Change point of transplant. The changes to transplant medical care after the downgrade to Category 5 are: 1. The government will abolish infection control measures related to transplant. 2. Countermeasures against infectious diseases after the downgrade will be determined by the transplantation medical field. As a result, Japanese are accepting donors from blinded patients infected with the COVID-19. The number of organ donations has returned to pre-COVID-19 level, and the number of organ transplantation surgeries is actually increasing. Next slide. Measures after transition. Organ transplant recipients are considered to be at high risk in terms of infectious diseases control measures after the transition to Category 5. Specifically, 1. If the patient develops a fever, the patient should self-test for COVID-19 infection, check how to receive outpatient treatment, and then visit an outpatient hospital that accepts the patient. 2. Public medical expense support has been changed, and the combination of public fund and health insurance has been abolished, effectively raising the medical cost for patients with a COVID-19 infection. Next slide. Recovery in the number of transplants. After the downgrade of COVID Category 5, the number of blinded transplants has been on a recovery trend. As this pie chart shows, there were 70 cases in 2020 red part. When the pandemic began, 27 cases in 2021 orange part, 92 cases in 2022 green part, and there are 89 cases dark blue part, and 43 estimated cases from September to December of this year, light blue, for a total of 132 cases, both of dark and light blue. Estimation of this year's organ donation numbers. Transplant has rebounded and continued to rise above pre-pandemic levels. Conclusions. COVID-19 patients have increased since the category downgrade. Public funds for testing and hospitalization have been abolished, so we have to pay by ourselves. The only new COVID-19 medicine are publicity funded, but we are wondering the safety or not, or effective or not. Next, the government entrust responsibility to transplant medical sites. So, government don't care about transplant anymore. So, transplant field, we have to do everything by ourselves. We have to be independent. And the final sentence, transplant number is recovering, but aspect is self-funded. Actually, getting expensive, and transplant medical staff and the recipient by themselves, or donor family, or concerned peoples about organ transplantation. We have to independent from the government, and we have to challenge it with an independent spirit after downgrade. So I think it's a good thing, but very challengeable and risky. That's the 4 months after of downgraded situation in Japan. Thank you.